When the COVID-19 pandemic spread to Houston, Texas, Legacy Community Health, the state's largest federally qualified health center, needed to respond quickly to ensure safe, accessible health care would still be available to its patients. 93% of Legacy's patient population is low income and relies on public transportation to reach appointments, increasing the chances of COVID exposure. And Legacy serves thousands of patients with chronic conditions, placing them at higher risk of COVID-19 complications.
Fear struck, like, oh my goodness, like I want to come in. I got that all the time. Like, Dr. Rowland, I want to come in. I know I need to come in, but I just don't want to take the risk.
Days before the United States declared a national emergency, Legacy's IT department began evaluating telemedicine options.
By the 18th, we already had providers see patients in our behavioral health department, and by the 23rd, we had everyone in the agency up and running.
And in just 2 weeks, Legacy had successfully implemented telehealth services.
And I felt great as a team member to make that happen quickly and securely for our team.
3 months later, nearly 41% of Legacy appointments were via telemedicine calls and video chats.
Our physicians love being able to see our patients in a way that is very efficient and very safe. And our patients are so appreciative of the fact that they don't have to come to clinic and expose themselves to the risk of COVID.
It's been really good, and I think I like it better that way because I keep my appointments, like it's no conflict with work.
Although most telemedicine appointments have been for behavioral health, Legacy's providers and patients are also connecting virtually for primary care, OB-GYN, and pediatric visits.
I've actually trained my patients ahead of time now to take their temperatures, to take their blood pressures if they have problems with hypertension. We can ask them to go get their medications out of their medication closet. We can go through them one at a time and really clean out their medications. We have learned ourselves as providers how to cue into subtleties, like if a patient has a hard time finishing a complete sentence, that lets us know that they're really short of breath.
I've had a couple of telemedicine visits where they were at work and they were like, let me go into a break room and see you real quick. Or I've had some patients that are like in cubicles and they're speaking to me while they're still in their cubicle.
Patient satisfaction scores reflect telemedicine success, with 9 in 10 patients reporting satisfaction with their telehealth video visits and quality of care by their provider.
This has really allowed us to continue giving care to our patients without missing a step. Our no-show rates are comparable to the no-show rates that we had before. All of our patients have been able to continue receiving consistent care throughout this time.
I'm able to keep up with speaking with my doctor and taking care of myself just because knowing that I can do this. I just know that this has helped me so much.
Beyond COVID-19, telemedicine will be a valuable option for patients with inflexible employment schedules or unreliable transportation while increasing access to care. At Legacy, we're connecting our communities to health every day in every way.